Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 396,270 confirmed cases of COVID-19 in Canada and 121,746 cases in Ontario. Chatham-Kent has 518 cases, and Sarnia-Lambton has reported 417 cases. Michigan now has 380,343 cases, with 21,033 cases being in Detroit. Today, we are reporting 65 new cases of COVID-19 in Windsor and Essex County. Of the 65 new cases, 5 are close contacts of confirmed cases, 2 are community acquired, and 58 are still being investigated. We have had 3,864 cases since March. 4 of our recent cases have been transferred to other health units. 3,358 cases are now resolved, and 424 cases are active and being followed by our health unit. 27 people are currently in the hospital, and 7 people are in ICU. Our community has lost 82 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 21 active outbreaks in Windsor and Essex County. 6 are in long-term care and retirement homes. There are 8 workplaces in outbreak, 3 schools in outbreak, 2 community outbreaks, and 2 hospital outbreaks at this time. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household, the people you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors. Outdoors, if physical distancing cannot be maintained, or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue, or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 assessment centers: Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington, who have added an additional 50 more appointments to their schedule to help meet the demands for testing. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Excuse me. Good morning, everyone, and thank you for joining us today. Cases in Windsor-Essex continuing to increase. Our region has already seen 3,864 cases and 82 deaths that were attributed to COVID. We'll try to break down these epidemiological data in our region, and also we'll look at what's happening around the world. So this is generally what we will cover. Looking at around the world, we can see how some of these countries are seeing the surge in cases. The key notable that I would like to mention is France and Sweden. The case count in France was increasing at a rapid rate and surpassed every country when it comes to daily new confirmed cases per million population. They put restrictions in place in late October, early November, and their case counts dropped significantly. So for those who think that these restrictions don't work, there is strong evidence, and even backed by many of the other research, that all these restrictions work, and it helps to bring the case counts down. It will not work if we do not adopt those measures at a personal level. So it is a community as well as individual responsibility as well when it comes to bringing the case counts down. The second notable country, Sweden, and many people use Sweden as an example, especially those who oppose restrictions, and because they didn't put any restrictions, or which they apologized as well, because that led to many cases. And we can see that based on per million population, Sweden is the country that's reporting the highest number of daily cases in the world at this time. Looking at the cumulative cases, no surprises there. USA continues to have the highest number of cases per million population in the world, while Canada is still relatively better compared to many of these countries. Looking at the deaths, we definitely learned a lot about COVID in the last 8-9 months, and while the first wave resulted in deaths of many, the second wave, we're doing much better, but we also know that the death is a lagging indicator, and it typically lags 2 to 4 weeks after the cases. Again, looking at an example around the world, Italy right now has the highest daily confirmed deaths, and Sweden is way high up there as well. Overall cumulative death counts, Italy continues to lead based on per million population, and while Canada is there, relatively doing better with some of the other developed countries. Now focusing entirely in Ontario, this is what the picture looks like, our day-to-day newly reported cases every day in Ontario. And as we can see, with the first wave, we were hitting a maximum of close to 600 to 700 cases a day. And right now we are hitting a maximum of 1,800 cases a day, which is almost 3 times what we have seen with the first wave. Focusing locally, this is what our local epi curve looked like. While we had a strong first wave and maybe that went all the way into the summer, we started to see some changes, but now what we are seeing is consistently increased number of cases that are spread pretty much everywhere. And on the right-hand side of the graph, we can see all these cases. Every day is very different than what we have seen in the previous graphs. So this just breaks it down further from September all the way up to here, and as we can see, starting especially in November, that's where things started to go to the extreme for our region, and there are a number of reasons for that. We already touched on many of those reasons. Similar graph, just trying to smoothen the graph by using a 3-day moving average instead of day-to-day, and this is what it looks like, clearly indicating what's happening right now. It's definitely unusual compared to what we have seen in the past. This is the 7-day moving average, so instead of using it a 3-day average, so this is the 7-day moving average, and as we can see right now we are hitting a point which we have never hit even with the worst cases of pandemic in the summer. Our cumulative cases and deaths, as we can see, and we talked about this graph, the way to interpret this graph is if your curve is steep, that means we are doing bad, and this is exactly what's happening. Our curve is really steep for the month of November. We have had a lot of flattening during the July up all the way up until October, but right now we are seeing that completely changed. This slide captures the week-over-week incidence rate per 100,000 population, and again, what we are seeing here, the peak between of summer with the 26 to week 30, that's where we have seen most of the cases in the first wave. Now we are seeing that we are in our second wave, and the case from last week is the highest that we have seen, moving all the way, crossing 70 cases. Our most recent calculated case counts are 73.2 cases per 100,000 population, and as you know, based on the provincial restrictions and the indicators, anything that was above 40 would put us in the lockdown. So we are almost at double that that number of cases that we that put us at the red spot in the first place. In addition, as you know, the Health Unit has been collaborating with researchers from the University of Windsor through the Great Lakes Initiative for Environmental Research, specifically Dr. Mike McKay. One surveillance tool that is currently being explored through the partnership is the use of wastewater data to determine the prevalence of COVID-19 in the community. This particular plot shows the average ratio of the COVID-19 virus to the pepper-mild model virus. The results are then plotted, which is red line, against the confirmed cases of COVID-19 in Windsor-Essex, which is represented in the gray bars. The pepper virus is constantly present in wastewater and is derived from the consumption of processed pepper products such as Tabasco sauce. The findings are weighted to adjust for the population distribution in Windsor-Essex and indicates since the middle of November, there's a significant proportion of people with active COVID-19 infection shedding the virus in their stool, sometimes even before symptoms start. We are seeing a strong correlation with how much virus is shed and the number of lab-confirmed COVID-19 cases we are seeing in the community, alluding to the COVID-19 may be more widespread in our region. In some of the other regions that are using the same techniques with comparing the wastewater surveillance with the case counts, example Ottawa, they have found a strong correlation, and maybe this could be a predictor for cases that we can see even moving in the future. So what we are seeing right now with the case counts, with the wastewater data, is clearly surpassing the active cases. So in the next couple of weeks, we may see more cases. So that those are some of the predictive analysis that's being done around the world. We don't have day-to-day data, and we are working with the university to maybe get access to get everyday data. Right now, they're doing it in a 3-day cycle with lots of resource limitation. But this is something that we'd definitely like to support our university to get more accurate data that can help us to do more of this analysis. So right now, this is just an example that we put forward, and we'll continue to monitor these data to see what we are doing in the community and what's the correlation between the wastewater surveillance data along with the with our case counts regionally. So this particular graph looks at the week-over-week rates of Windsor-Essex compared to all of Ontario and southwestern Ontario. And as we can see, the yellow lines from the Ontario is clearly really high, given what's happening. And then Windsor-Essex is also catching up along with the southwestern Ontario. So this figure looks at all the tests and unique individuals tested by week in Windsor-Essex. In total, 144,747 tests were completed as of November 21st. And for the week ending on November 21st, our percent positivity was 4.3%. Last week, approximately 6,501 tests were completed. Looking at the percent positivity based on the 7-day rolling average, across the province and in all public health unit, while Peel has the highest 7-day percent positivity at 9.6%, Windsor in the most recent 7-day is 4.3%, and this is an increase compared to last week when we reported our percent positivity at 3.3%. This graph looks at the percentage of test results that are available within 1 and 2 days of someone getting tested using a 7-day average. Approximately 41% of tests are being processed with the results available within 1 day of being tested. Within 2 days of testing, 82% of tests are being processed with the results available for us. This graphs take a look at the turnaround time within 1 and 2 days from September onwards. So just focusing on what's happening with September onwards, and then we have seen some fluctuation, but generally it has stayed relatively stable. Okay. So our regional and provincial rates, this is what it looks like. Windsor-Essex had the highest rate in the province, but then some of the other regions surpassed Windsor-Essex, but our case counts that are increasing at a rapid rate, it definitely put us at a risk of even going beyond where we are right now compared to the rest of the province, and we're clearly way above the provincial average, and right now ranked at number 4 with respect to regional rates. So our rates per 100,000 by municipality, and this includes all the cases that starting from the beginning of the pandemic, while we have seen Leamington and Kingsville having their fair share because of the farm workers in that region, but with the rest of the municipalities doing relatively okay, with Windsor being the most populated city in the region with a large number of cases in there. Focusing just on the municipalities starting November 1st and onwards, and again a similar picture with Leamington leading because of the outbreak that we have seen in the farm population, and then followed by Windsor, which is seeing a large number of cases in the region. The age and sex distribution of all these cases overall is represented in the green. And while we have seen in the pandemic that the majority of these cases continues to belong between the ages of 20 and 40, we are seeing that trend shifting. In the last 2 weeks, our largest number of cases came from individuals between the ages of 0 to 19 years, followed by the 40 to 49, and then 20 to 29. So this is the last 2 weeks, but then now comparing the same data with the overall age and sex distribution starting from November onwards. So starting from November onwards, similar picture, largest number of cases between the 0 to 19 age group, but the other younger age group, we also seeing similar picture between 20 to 2 all the way up to 40 to 49. So this is the overall picture of where these distribution of cases lie in all of the municipalities, and what we can see is Windsor had the highest number of cases in the region, followed by Leamington and Kingsville, while the rest of the municipalities have some activities of the cases there as well. In the last 30 days, similar picture, but more pronounced effect in Windsor and Leamington, while the rest of the municipalities are seeing similar number of cases. Just in the last 7 days, again, the effect is even more pronounced, with Windsor almost having 3/4 of all the cases in the region. So this figure looks at the percentage of cases that cannot be linked to a previous case using a 7-day average, and currently approximately 24.3% of our cases cannot be linked to a source of exposure signaling community transmission, and again that fluctuated quite a lot. We've seen lots of community transmission in the end of October, early November, but it's at 24%. But you also have to mind, this is the proportion, this is not the actual number of cases. So because of large volume of cases that we are seeing right now, we are seeing an increase in non-epi-linked cases. So for example, if 25% of our cases are currently non-epi-linked, and if we factor that in from the 60 cases that we are seeing, so that means at least 15 cases that we have is non-epi-linked, which is quite significant in terms of the overall number of cases that we see in the region. So this graph breaks it down further to exposure history all the way from October to present, and even separating what is between the close contact, which could be non-household contact, and then you have household contacts, and then you have outbreaks related cases, and then you have travel related cases, and then you have community transmission. So community transmission, as we can see, back starting in October, those community transmission were low, and what we are seeing right now, especially in November, the community transmission as a proportion of those cases is increasing. What we are also seeing an increase in the yellow bars, which is basically the household contacts, and this is what we are finding, that when someone is infected, they are potentially infecting pretty much everyone else in the house. So even as we are talking about people having more opportunities for exposure, if they are going out and then bringing it back inside their home, they are everyone in their family is getting sick. And those are some of the reasons that we always remind people that maybe, yes, you are healthy and maybe you can recover from the virus, but some people cannot. And I cannot imagine if someone brings a virus back into their home and potentially impacting someone who would be at a risk of developing more severe complications, and if something happens to them. So something to be mindful of in terms of our responsibility and our activities when we are not home. Looking at the overall acquisition of cases, again, starting from October onwards, and what we have seen is 29% of these cases are acquired. Let me just take a step back. So this percentage of exposure is starting only from November, and what we can see right now is the majority of the exposure that we are seeing is through the household contacts, as I was alluding to in the last graph, 27.1%, and then the next is the related to outbreak, as we have many outbreaks that are currently open, and Teresa provided that number today. I believe it was 21. So that's quite a large number of outbreak that we have in our region, and then followed by 22% of the community transmission. So this is significant that we want to see what happened in the last month with respect to the exposures. So the number of outbreak, as I mentioned, right now we have 21 outbreaks, and we can see how quickly these numbers added up in terms of reaching up to the level where we are. We have never had that many outbreaks, clearly indicating that we need to do more. Everyone needs to do more in terms of preventing any transmission. Either we're talking about workplaces, either we're talking about the community, everywhere that are currently accessible to the public despite all these restrictions, that we have an obligation, we have a responsibility to follow all these public health measures. Looking at the hospitalization and COVID-19 cases in ICU, again, the trend is concerning as we continue to see that the hospitalization average is increasing. The ICU is relatively stable, but we are still seeing that number fluctuates, definitely limiting the ability of the hospitals for providing those essential services. And as we know that as we are dealing with the hospital outbreak, this is putting further strain into the already stretched healthcare resources, and along with the healthcare workers that are struggling to contain the outbreak and provide care to all the patients. Again, this just focus on September to present, just pronouncing the impact. This is showing the September 19 to present, just the COVID-19 hospitalization in our region. So as you can see, September, we have had cases in the hospital with COVID, and that number is increasing in the last month or so. The acute care capacity, as we can see, is again, these are just the beds that we are talking about, but it's not reflective of how many people need isolation, what kind of support that they need, which potentially almost always put them more than above 100% capacity. So this is an indicator, but obviously the ground realities within the hospital can be different. The critical care capacity picture, similarly, it's touching the 80% mark, obviously stretched with many of the capacity issue from the staffing and from the outbreak perspective. Just more pronounced from September to present. And then this is the adult vented critical care capacity, which is close to 30% at this time. So where are we with all these cases? We have seen many active cases in the recent times, so that's why the number of cases that are currently self-isolating has increased quite significantly now, and it's standing at 8%. And unfortunately, we lost at 2% of our cases to COVID. The age and sex breakdown of COVID-19 deaths that we have seen in the region, again, no major changes, but as we reported that there are young deaths, people in the 60s who lost lives to COVID more recently. But generally in our region, the individuals who lost their lives were people in their 80s. Our overall case fatality rate when compared with the province is definitely much better, but again, it's a life lost is a life lost for those who have lost their loved ones. It is important, and every life counts, and this is what we are seeing right now. So overall, when we are comparing ourselves with the province, the provincial case fatality rate is 3%, where in Windsor-Essex we had 2.1% case fatality rate. If we're just comparing the long-term care home, retirement home with Windsor, and for the province, once again, our case fatality rate in the long-term care home and retirement home is much better than the provincial average. Looking at the doubling time, we had a pretty good run in August and in September with the cases declining while the rest of the regions of the province have seen an increase, and this effect is more pronounced here. But now we are coming close to where the case doubling rates for the province as well as the Canadian case doubling rates stands. Indicating that we need to take more action and more control to decrease that number. The most recent estimated median R0 is 1.07, which is good from a number perspective, but what we are seeing with the cases, so we are still seeing 60 plus cases every day, which is quite a lot. But if the, let's say, if they are not increased, that means the trend is even suggesting that we are increasing doubling our case rate very quickly. So if we're reporting 60 cases, and in the next week, if we jump all the way up to 120, God forbid, then the R naught will continue to increase. But even R naught staying at 1, that means still every case is infecting one more case, and the case will continue to stay stable. So ideally, we like to see the median R naught going down less than 1. That would show us that the cases are starting to decline in our community. So that's not happening, but maybe with some of these restrictions in place, we may start to see that number going down. So in summary, we are well within into our second wave, and the most challenging part with this second wave is the acquisition source. In the first wave, we know that there were cases in mainly limited to the farm workers, long-term care homes, and in some specific population that we have seen. But now the acquisition source is distributed everywhere because of many activities, because of large social gatherings, and people continuing to not follow many of these measures. Maybe they're following it in public, but they're forgetting that even when you're meeting, having these social gatherings with people that you know, but you don't know their exposures, and you don't know if it takes only one person to come and infect everyone else. So it is important that we try to keep that in mind. Our hospitalization rate has increased in the recent times, and it's putting more pressure, especially when the hospital is an outbreak. And not only outbreak in Windsor-Essex, as we know, there's a hospital outbreak that's happening in London too. So in the entire region, the acute care capacity is stretched, and signaling that we all need to take some action to prevent all these hospitalization and protect our healthcare system. Our day-over-day doubling time in Windsor-Essex we did well, but now we have decreased that, and now coming closer to the Ontario and Canadian average, which is something that that would mean that we'll continue to have more cases. The effective R naught value is 1.07, which is, again, we like to see it going below 1 to signal that the cases in our community is decreasing. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. I'm just wondering, as I sort of absorb everything that you're saying, it seems to me as though a lot of this is on the shoulders of the community. Yeah, you know, we keep putting more policies in place, and we could be going into a lockdown, but I'm wondering how much of this is, there's only so much health officials and policies can do. It's really on the shoulders of the community to take this more seriously. So I'm wondering what you think about that.
Katerina, I think you made a good point, and that's what we keep saying, that all these measures are measures that we can put in place, but it's us who have to follow those measures. And if I am not following those measures, and if I'm trying to cut corners and try to do the thing when I am being watched or I'm being monitored, and if I don't want to do it when no one is watching me, I think that's where we put everyone at risk. And a lot of these activities, as we have identified, that is happening because of close contact, household close contacts, community transmission, and all of those things require that everyone, every time when we are meeting someone who doesn't live with us, and I like to say that, and I don't feel ashamed about saying that anyone I like to meet that's outside of my household, I should suspect them that they may have COVID. What do I do to protect myself from them? Because if I get infected, I'm not only infecting myself, I'm putting my entire family at risk. And we have the data to see that all of these families are turning out positive. So it does go back to our individual responsibility. And there's one graph that I didn't show, and I was talking to Teresa this morning as well, that there is a good evidence that when we look at the average number of close contacts that we have seen starting all the way from August to October, our average number of contacts was less than what the provincial average number of close contacts were. But we have seen a complete shift in the end of October, in the November, when our average number of close contacts has increased by as compared to the provincial rate. So there is something I think we have done well in August, September, and even in October. Our community has done excellent. When cases were increasing in every part of Ontario, our community did very well. But I think somewhere along the line, maybe they got the wrong message that our case counts are low, so we don't need to follow those measures. And I think that's the wrong message, that we had the case counts low because each one of us was doing our best to keep the case counts low, to be vigilant, to protect ourselves. But somewhere down the line, I think we missed that message, and we basically just lost that control in our own behavior, and people started taking chances, and that's why we are seeing all these cases. So I really hope that we get back to the conversation and talk about what is my role, what is my responsibility as a community member if I am out there. What do I do to protect myself and take my part in reducing the spread in the community? So clearly, the individual, we need everyone's support, and we want everyone to follow those guidelines.
Thank you. I also have a question about Bigley and Langlois and the outbreaks there. I'm just wondering if you can provide us with an update, because we know that the boards have been working with you to reopen schools. What can you tell us about that process, and when do you think it will be safe to reopen both of those schools?
So we have had conversations with the schools and the school board, and we have about in Bigley, they are able to. We're working on a plan for next week that some people would be able to return to school. About a quarter of their cases are still resolving, not resolved quite yet. So we would want to probably have a staggered approach to return, but we are working with the schools and the school board on that. We have a return to school plan. And as well with the other outbreak that is at Langlois.
Thank you.
Any questions from Blackburn?
Yes, good morning. I remember in the last first wave when we were moving through stages, there was always a 2-week period because of the delays and just kind of like how the effects were presenting in the numbers. And now with the delays in testing, the cases that we're seeing now, are these as a result of what we were doing, while we were still in the yellow stage? Is it still too early to say if even the orange or the red is making a difference in our case number?
Well, that could have been a thought, but I think even the cases that are continuing to increase. So I think we know from the research evidence that taking steps earlier have a better impact. Once it's widespread, it's very difficult to contain. So even when we are talking about how many active cases we have, it makes it difficult to contain. So even if we put everything right away, it will take us some time to get that number down to prevent that spread, especially that are spreading as a result of community. So I don't think that the numbers that we are seeing is still lagging. I think the numbers are the numbers, and it could have been much worse if we didn't move forward with the restrictions earlier on. And there are still a number of avenues that we are exploring in terms of focusing on those specific areas that is impacted more than the others. And right now, as we reported, that despite all these restrictions, our case counts is at all-time high, with our cases in everywhere, with 21 outbreaks for our region. It is significant, and I think we all need to understand that the impact can only be seen if we all do our part.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. You mentioned that there's a 25% non-epi-linked cases. Can you explain what the non-epi-linked means? And does that mean that we aren't are or are not seeing those cases reflected in the chart that shows the transmission source?
Well, when we're saying that non-epilink, so this is basically, in other words, you can say this is the community transmission. So when you have 25% of cases that are currently are non-epilinked, or we don't have a source that we can pinpoint, or the case where the cases were acquired. So that's what we are referring to. And in the other chart that we showed with the different colors, including red, yellow, and blue, those are the colors that we can see when, to give you a breakdown of day-to-day cases in the region.
And then earlier this week, I asked, there's a graph on the Health Unit website that does the exposure breakdown, and it includes community transmission or exposure, as well as an unknown category. Did you ever figure out why there's that differentiation?
Yeah, so Taylor, thank you for the reminder. Yes, we did follow up on that. So exactly one of those reasons that sometimes some of these cases are a delay in terms of us finalizing what the source of exposure is. Because of the interviews, sometimes we get some indication and then we follow up on them. Sometimes we talk to them again and to put that as an exposure source. There were some data quality issue as well. That's why we are seeing a large number of cases that are resulted in the community transmission, which is because of the data migration. And if you recall, back in the time when we said that now we are using a different system, CCM, which is rolled out by the province. So there was some data quality issues, but more recently, I can say that what you're seeing is much more accurate, and there's not a lot of missing information or non-epilinked cases at this time. We are attributing it all to either a source or identifying clearly as the community transmission.
Okay, so on the website, the graph that I'm looking at now, it shows 597 unknown cases by exposure type. Would that mean that those would be, you're still waiting for the website data to reflect the update that you're talking about?
No, some of that data would be a challenge to update because of the data quality issue, because the data migration issues. And I think it would be hard for us to even put them in any category. That's why it's reported as non-linked. But those who are identified as the community cases, I think that's what it's reported. And we'll see if there's any better way to report that. But we did had the conversation, and some of that is the data migration and data quality issue that we had in the past.
Okay, and then finally, I'm receiving questions from members of the community who are asking, what expertise are required to do case and contact management? Can people volunteer to do that work? So can you explain what expertise are required and why you aren't able to just ask people to volunteer to help you combat the strain on public health resources?
So the case management part of the follow-up that we do with COVID is very similar to any other infectious disease. So we are typically having health professionals do that work, and internally we're using RPNs and RNs to do the case follow-up. And that's very similar to, as I said, our infectious disease process for every other infectious disease that gets reported to our health unit. So there is expertise in interviewing and ascertaining the necessary information like exposures and risks and possible acquisition times, dates, symptom onset, all of that. So that is a more in-depth skill that we need. For contact management, there are specific requirements to make sure that we're contacting the high-risk contacts, and as well informing them, giving education, and making sure they're appropriately isolated and know what to do if they do develop symptoms and what symptoms to look for. So that is a little bit more broad. Right now, we also have the same pool of people that are doing both. So our nurses are doing cases and contact management. The contact management that we have from the province, they are health professionals that have been vetted through the province. So they may not necessarily be a nursing profession, but they have other professional skills that would help them to do this work. So it's not that people can necessarily volunteer, and it's all, as Dr. Ahmed, he talked about CCM, so this is the province's way of how we receive our cases and document and communicate back to the province. So it's not a simple phone call. There's documentation, accountability, follow-up. There's several pieces to it. So we appreciate the interest in helping and doing your part, but I would agree with Dr. Ahmed at this point. We really need people to go back to the original public health measures and not take chances and assume that everyone they're interacting with could be COVID positive. So hope that answers the question.
It does. Thank you very much.
Any questions from AM 800?
Yes, good morning. I'm just wondering, Dr. Ahmed, if you had that conversation last night with Dr. Williams and provincial representatives in terms of what's happening here in Windsor-Essex, and if so, how did the conversation go?
So we didn't had any conversation, but we did got our numbers. We did exchange some communications, and we would like to see the results of us in the red zone first before we move on to any other criteria at this time. So I am hoping that there will not be any changes in where we are right now, and unless I'm surprised, but to my understanding, I'm not expecting that there will be any change.
Okay, so to be clear then, you're not expecting that it will be announced today that we will move into gray or lockdown as of next week?
That is correct.
And so when it comes to hospital capacity, obviously it's very, very strained, and our 3 local hospitals have just sent out a joint news release essentially begging the public, for help. So I guess what is your message when it comes to hospital capacity and where we're at with that?
Yeah, no, my message is similar, and I think we've been talking about it for almost a week now, about the strain that is putting on not only on public health, but also on the health system partners. Because every outbreak, every cases that we are seeing, they have to connect with the healthcare system in some ways. So even starting from some of the discussion that we had yesterday about the assessment center, the delays at the assessment center, because more and more people are going there to get tested because there is more exposure. We talked about the number of close contacts. So even when we're investigating one case, and if they have like 7 or 8 close contacts, and if they are symptomatic, they will get tested, and that is more people going to the assessment center, putting a strain on them. We also know from the data that 80% of the people may not necessarily need any healthcare support, but 20% may need some support. So they will go to the hospital, they will go to the healthcare provider, and the capacity that I reported today as well in terms of the beds and the number of cases that are increasing, and already strained our acute care system when there's an outbreak that's going on. So we have an outbreak at the Windsor Regional Hospital, we have an outbreak at the Hotel Dieu. Their capacity is limited. They can only take care of people that they can safely do it. There is a staffing challenges that they have to take that into consideration, and then not having the ability to transfer some of their patients to the Hotel Dieu Grace Healthcare. That's also limiting their movements as well. And then looking at it from overall, they may have to think about, okay, what else we need to do from a surgery perspective, or the scheduled surgeries. Do we need to cancel that? Do we need to change that? So there's a lot at stake at this time. We definitely don't want to be another region or another country or another city with what we have seen when pandemic in other areas, where the hospitals are basically overblown by the number of people that are, and then they have to make the tough choice, who they want to save and who they don't want to spend time saving. We definitely don't want there. We definitely don't want to postpone many of the elective surgery, even though the word is elective, but those are key services that people need to improve their quality of life. We don't want to delay that. And we have seen all of that. So there's definitely a lot of pressure in the healthcare system in the region, and also across southwestern Ontario, as I reported about the London Health Sciences outbreak as well. So as a region, there's only limited resources that we can tap into, and everyone is stretched. So I would echo the message that the hospitals are putting forward. We do want people to follow all those public health guidelines. So as a community cases, we need to decrease the rates of community cases in the region, and that would automatically result in reduced pressure on the healthcare system. And then overall, we can save more lives, we can keep more people out of the hospital system, and then keep everyone healthy. So definitely an important message, and I would like to echo that same message.
Okay, thank you.
Any questions from CTV?
Yes, good morning. I apologize if this is a bit repetitive, but it seems as though we've got a number of lags in the system. There's a delay in testing, there's a delay in getting the results, and there's a delay in the contact tracing. What, in your opinion, needs to be done to right the course here? So
Right now, we are in red zone. There are very specific recommendations for people. People should not go out. That's period. That's the recommendation, recognizing that not everyone would follow that. But if 90% of the people or 95% of the people are following that, we are winning. Because when we are staying home, even if someone is infected, we're not spreading it further. And that's the key message. So we, as much as we are limiting all those close contacts, that's where the key is. So as difficult as it is right now, we don't want people to go out. We don't want people to have any kinds of gathering, any kind of events, which is exposing them to other people. That needs to stop. And I think, we always talk about businesses. Switch the conversation. Let's talk about individuals. Let's talk about me. What am I doing? What is my expectation in the red zone? Am I fulfilling that expectation? That's the key piece. So even if the businesses are open, and if I am someone who is at risk, and if I'm not going outside, then I'm preventing those risks. So I think as a community, switch the conversation, talk about individual, talk about myself. What is my role? What do I have to do in the red zone? And follow that to keep everyone safe. Until we do that, we cannot ease that pressure that everyone is seeing in the system.
Is there anything that can be done on the health unit or hospital side to change this, like maybe making the assessment center available to walk-ins as opposed to appointment only? Is there an ability to do an increased capacity for testing?
Well, we had that, and again, going back to the same idea that it has almost like a domino effect. So if you start testing all those people who probably don't need testing, you're putting more pressure on the lab system now to ensure that all these specimens are tracked and reported. Then we start to get delay in the number of tests that are reporting back to us. For the purpose of allowing people who haven't had an exposure, and I think that was a concern. And we know the assessment center in Leamington, they already increased their spots. So those are some of the measures that we can do locally to make sure that people who need to get tested, they are tested. And then when it comes to more of the acute care capacity, I think the hospitals can speak for themselves that what would help them or not. But from a community perspective, I think we got lots of support. So we are hoping, both Teresa and myself, that next week would be a better week with all the additional support that we are getting from the province to do our case and contact management. So we will be able to follow up on those cases very quickly and then contain them. But again, doesn't matter how many resources we put in case and contact management. If we continue to get 60 cases, and if it continues to increase 100 cases, 200 cases, there's nowhere in the world that doesn't matter how much resources you put in, you cannot contain it. The containment has to happen by reducing the case counts from the source. So let's focus on reducing the case counts by following these measures rather than thinking about what more we need to do to follow up on that. Absolutely, that is critical, the containment strategy. We will do everything. We have been working nonstop all our healthcare system partner, I'm not speaking just for myself, but all our healthcare system, our staff, they are tired, but every day they're coming in motivated to do their part, and sometimes it takes them to the breaking point. So we need to reduce the case counts for sure. From the capacity perspective, public health, we are getting some additional support. Things will be much better next week. From a community perspective, I think we need to do our part, and I'm sure with the hospital, they can have more specific needs if they want to identify, but as a community, we all have to take the responsibility just like we have done. I know we can do it because we have the data to show that August, September, October, we have done amazing. We just need to get back to the same timeline and start doing the same thing.
Thank you, Doctor.
Any further questions from CBC?
Yes, I'm just wondering, in terms of hospital capacity and beds, I believe it was a couple of days ago during question period that the Minister of Health said that it would be assisting with additional beds to our region. And I'm just wondering if that has occurred yet, and what other supports we're getting from the province to address our capacity issue in the hospital system.
Katerina, I would want to defer that question to our hospital partner. I don't know the exact conversation, so I may not be the right person to answer that question.
Fair enough. And I do just have another follow-up question on schools. And forgive me if this has been asked before, but I just wonder, what is the local threshold for shutting down schools? If we don't go into lockdown, is that something that you're considering at the local level? Because again, we saw, more cases today in schools again. So I'm just wondering if you're considering that.
So Katerina, good question. We struggle with that question every day. Every day when we are seeing the cases, every day we are dismissing a cohort, we question that. We like to follow the evidence, and as much as we can think about it purely from an emotion perspective, that yes, we need to take action. There's a lot of kids in the school. There are a lot of risk that they are going through, especially if they have any cases. So we are looking at our data very closely. We're trying to understand where are those gaps and what do we need to do. In terms of setting up a threshold, that I think we have a low threshold even when we are talking about declaring an outbreak or dismissing a cohort or dismissing the entire school. We have a low threshold on that. But making a decision on the system level, I think that would be something that I expect that the Ministry of Education, they have to come forward. We have that conversation regularly with them. We share our data regularly with them, so they are up to date. But from a local perspective, we have a low threshold. If we have a case, if there's any evidence, we're dismissing the cohort. We are making sure that all the appropriate measures are in place to keep that to keep our schools safe. Most of these cases continue to come from a family first when they're infected, and then as a result of them infected, they're passing it on to their children, and then children showing up at the school and resulting in the dismissal of the cohort. And if there's anything more that we can do, we'd just like to remind, ensuring that the system that are currently in place, are they being followed or not? I have heard anecdotally, obviously, is the school systems, the students, the children, and they are relaxed right now. They're not following everything that they should. People were really focused. People were really interested in keeping everyone safe, in maintaining their physical distancing, wearing the mask, following the protocols, following the path, how they're coming, entering, exiting the school. Not all of that are being maintained at this time. So I think there is that dual thing. But from a health perspective, from a public health unit perspective, I don't hesitate to dismiss any cohort, and I would not hesitate to dismiss the entire school if there's any risk that we can relate, and then any risk that we can see that if not making that decision would put anyone at risk, I would not hesitate. I will dismiss the school, and but as an entire system, I would defer that question to the Ministry of Education to make that call. Locally, any school at risk, I will make the dismissal.
Thank you very much.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AM 800?
No, thank you. Have a good weekend.
CTV?
No, thank you. Take care.
Thank you, everyone.